Welcome, and thank you for tuning in to A Sound Constitution on CHLY 101.7 FM with Ryan, Matt, Aminder, Alicia, Matthew, and Emily. We are fourth-year BSN students at Vancouver Island University in Nanaimo, British Columbia. We're working to demystify health issues affecting our community, bringing you evidence-based information about healthcare. This information is for educational purposes only and does not replace the advice of your primary healthcare provider. We would like to start our show by acknowledging that we are on the unceded territory of the Snuneymuxw people with a broadcasting range that overlaps the Kwotsun and Tla'amin territories. This acknowledgement is done with gratitude to the Snuneymuxw people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding Snuneymuxw history, reconciliation, protocol, and land acknowledgement can be found on our Facebook and YouTube pages. Hello, one and all, and thank you for tuning into A Sound Constitution. My name is Ryan, and I'm joined here by my colleague and very good friend, Emily.
Good afternoon. Hello. Thanks for having me here.
Glad to have you co-hosting with me. The two of us are fourth-year Bachelor of Science in Nursing students at Vancouver Island University, and today our episode is focusing on palliation and end-of-life services and care, and how it's been affected by the COVID-19 pandemic.
Yeah, I think that, even in normal sort of non-health crisis times, death and dying is probably one of the most difficult things that people will deal with throughout their life, either as a caregiver, a friend, a family member, or personally as well. And especially when we're in a global health crisis, I think the biggest thing that I've seen personally being in the hospitals as a student nurse and with close friends who have had people in their lives pass away recently is just how difficult it can be to kind of get in touch with your support network, how isolating it is, and we're not really able to have major celebrations of life or anything like that. We kind of have to keep things small and socially distanced and stuff. So for people that are very close with their family, it's quite a difficult time to be going through this process when you mix in a global health pandemic. But same could be said as well for anything else that could happen, earthquakes or any global or local health emergency.
So, as we already established earlier, today the focus of our episode is on palliation and end-of-life care. And in exploring how it's been affected by the COVID-19 pandemic, we've spoken to a couple of interesting individuals who we'll play the interviews of later. The first person we interviewed is named Mary Ann Maloney. She is a Bachelor of Science in Nursing faculty member at Vancouver Island University. She has a fairly extensive background in working in palliative care and quite a passion for the area. So we spoke to her to just get some insights on what palliative care is, what end-of-life care is, and how she could foresee it being changed by a pandemic. And then later in the episode, we interview one of our colleagues from the nursing program. She's a fourth-year nursing student like us. Her name is Carly. This summer, she actually worked in palliative care during sort of the first wave of the pandemic. And I spoke to her to gain some insights about what that was actually like and how what was normally done there has been changed by the pandemic. We hope that by tuning in, you're able to enhance your knowledge about end-of-life care on Vancouver Island and learn to better support others who may be facing the death of a loved one during this time. So, I guess a good starting position is, how has palliative care on the island been affected by the pandemic? Currently, island health facilities are restricting visitors to essential visits only. According to Island Health, essential visits can include, but are not limited to, visits for compassionate care, including critical illness, palliative care, hospice care, end-of-life, and medical assistance in dying, visits paramount to a client's physical care and mental well-being, and visits required to move belongings in or out of a client's room. Essential visits are limited to one visitor at a time per client, and visitors are screened for signs and symptoms of illness on arrival and are expected to uphold social distancing rules and wear masks. These visitor restrictions significantly affect palliative care in Island Health facilities, with many people unable to be present with palliative family members due to only one family member being allowed at a time. Island Health is currently encouraging families to speak to their loved ones via phone or video chat if they're unable to be physically present. For up-to-date information on in-hospital palliative care in the Island Health region and what the visitor restrictions currently are, we will include a link on our social media to the Island Health website where they actually have that information up to date and available for you to check on. Island Health continues to offer home end-of-life care services. Those wishing to die in the home environment can do so with support from a range of health professionals, free of charge. Home palliative care services are being offered by Island Health through virtual methods as well. These virtual programs are offered in Parksville, Qualicum, and certain areas of the North Island, such as Port Hardy, and they're aimed to support palliative patients and their families in between in-person visits from home care nurses. For up-to-date information on home care for palliation through Island Health, we have a link to the Island Health website with specifically their hospice palliative care services page. And up-to-date information can be found on there, and you'll find that on our Facebook page as well.
Yeah, so specifically when we kind of look at COVID-19 and what limitations around the grieving process or the palliative care process, I think that, like you mentioned, there's the restrictions on visitors in the hospitals. And that's a pretty big one, right? Because it goes back into that isolation. And somebody that is in a palliative care process, they also kind of go through a grief and grieving process as well. And that's really difficult to do when the amount of time and people that you can kind of visit with face to face. So there's good options like mentioned, like video calls and phone calls and stuff. But I mean, at least from my experience being in the hospital, like a lot of people that doesn't really work as well for them.
Mm-hmm.
And yeah, I don't know, because you were in a different placement obviously there than I was, so I don't know if you kind of have had any thoughts on that or anything, or had any patients. But I think that one of the things that I saw as really quite difficult in that process is if you're not on that palliative care floor that we're going to kind of talk to Carly about later, it becomes very difficult, right? People were typically only allowed visitors if there was like an imminent death for that patient. So we kind of had to time things right, and then it's one person that's there, and that's a lot for that one person to take on, right?
Yeah, absolutely.
Yeah, because they're just there at the bedside. They don't have their support network as well. So it's just kind of isolating for everybody. I mean, the whole pandemic obviously is, but I sort of think that's the biggest thing that's been affected in that process. And I mean, even if we look at like the BC CDC, sort of when we're kind of in that process of planning for a celebration of life or memorial service or anything like that, we're kind of again needing to be really careful, especially now as we're going into winter and we're seeing cases rise up. We're kind of being told to shrink down our groups and our numbers of contacts again. So a lot of the recommendations, I won't go through them all, but we'll post a link there. But washing your hands, social distancing, wearing masks, avoiding enclosed spaces. Yeah, so just those kind of things, not inviting a lot of people. But that's difficult. I mean, I've, as most people have personally, I've experienced some very tragic loss in my life, and it's if I could imagine it happening right now, it would be a struggle to not have those people close by and in person. Because when you're sort of struggling with that grief and grieving process, it's hard to pick up the phone sometimes.
Yeah. Oh, absolutely. And kind of speaking to like funerals and services for people who've passed away, like, I mean, I haven't personally experienced it, but my hometown community of Powell River, they were quite heavily affected. Specifically, the Tla'amin Nation, which is the indigenous nation in Powell River. They ended up having a funeral service there where they actually had an outbreak of COVID-19 that was traced back to that funeral service, and it affected the entire community. And it was actually quite tragic, just the fact that just trying to have a funeral service for a loved one in the community, especially a community as close as the Tla'amin Nation, like it was very, very impactful.
Yeah. Oh, absolutely. Yeah. And how do you deal with that? Because different cultures, like especially like First Nations, they have like their celebrations are quite integral to their culture, right? And not being able to do those things, it really starts to cause distress. I mean, lots of other cultures also have those as well.
Yeah,
It's
exactly.
it's just distressing, right?
Mhm.
I mean, and that sort of, I think I've probably through this series have said this so many times, but um, picking up the phone, if you have a friend that is kind of in this position, has a family member that is in palliative care or has passed away recently, you pick up the phone, call them, check in with them often, be there in what capacity you can for them is the best advice that I can give. It's not always a big grandiose thing. You don't need to have all the answers, but just picking up the phone and giving some normalcy. How are you doing? What's on your mind lately? What can I help you with? Sort of thing.
Exactly. Being as present as you can be with the restrictions that are currently in place. And yeah, the restrictions definitely make it more challenging, but with the amount of technology that's available to us in this day and age, it doesn't make it better, but it does make it a bit easier to navigate, because you can do video calls, because you can pick up the phone, because you can even send messages to someone with good wishes. Like, up next, we're going to play Emily's interview with Marianne Maloney. As we already established, she is a faculty member in the Vancouver Island University Bachelor of Science in Nursing program, and she has a pretty extensive background in palliative care. But she speaks about that in the interview, so we'll let her introduce herself.
I have a palliative care specialty certificate that I worked in hospice when I was living in Scotland several years ago. And so palliative care has been one of my passions in nursing for quite a while now. And I think that holistic care that you provide to people, it carries over into every aspect of nursing and even your personal lives, when it comes to taking care of people and alleviating their suffering and that sort of thing.
Yeah, absolutely. I agree. I think as somebody who's had family members in that position and being cared for by palliative care, yeah, I think that's exactly it. And the nurses that work in that role are so skilled in what they do and helping the family feel supported.
Mm-hmm.
Yeah. So pre-COVID, pre-global health crisis, where we can't kind of go in and visit and things like that, what does the end of life kind of care process look like in palliative care for families?
Well, usually, whether somebody is dying at home or on a palliative care unit or in a hospice, the focus of care is on managing pain and distressing symptoms, and also providing social, emotional, and spiritual support for the individuals and their families. And by families, I mean, all of their loved ones and caregivers, even if they're they're not related. And the emphasis starts with providing physical comfort, because without that, it's difficult to kind of experience emotional and spiritual ease or have the energy to spend time with loved ones. But at the same time, palliative professionals create a space for people to spend time together during the last days and weeks or months of life. And it's very much a team approach that involves the family and the person and physicians and nurses, but also volunteers, social workers, spiritual care specialists, counselors, dietitians, pharmacists, so that people get advice and support to meet all of their needs. Yeah. And typically, family and friends are encouraged to visit, hang out, tell stories, share memories, express their feelings of love and loss, what's brought meaning to their lives, what they love and appreciate about each other, or sometimes working through stuff, forgiving and asking forgiveness, healing problematic relationships, letting go of baggage they don't want to take with them on this journey. And people would also be encouraged to, if they were in hospice or palliative care, to bring in, personal belongings, photos, things that would provide them comfort or, trigger fond memories, something that might have sentimental value or some meaning for them. And then there's also support for end-of-life decision-making, getting the person's affairs in order, planning rituals and services. Then there's bereavement support for families, groups as well as individual counseling.
It really encompasses
very, very
a
holistic
lot.
care, all in all.
Yeah. Wow. Yeah, that's definitely a lot, and so much of that is, you're dealing with families who are already kind of at kind of their coping capacity or well beyond it as well. So it's hard to take in information and hard to kind of manage everything that's going on. So I think it helps having all of those supports in place from all the aspects of healthcare, like you're talking about.
Yeah, and access to information and everything like that.
Yeah, absolutely. How do you feel like that may, obviously not having firsthand experience, but if you were to kind of just think about how that might change in a situation like we are in at the moment, where visiting restrictions exist and such?
Well, I certainly know people that have lost, loved ones during this time. And I think the restrictions on who you can spend time with and how and where, is the most obvious change. In hospital or hospice, visits might be restricted to certain hours or only one visitor at a time. You have to wear a mask. Physical contact is limited. You have to leave the room when care is being provided in order to give staff enough space. They'd be discouraged from bringing in those personal items for infection control reasons. I know on the palliative care unit here, the kitchen's normally stocked so families can help themselves to tea and toast or whatever when they're spending long hours at the bedside, and that would be off limits, again, for infection control. And so
I would have never thought about that. Yeah. Wow. Yeah.
And even just the common space where they can hang out when they need to take a break, if there's other visitors or the person's sleeping or they just need, a change of scenery, that would be off limits, or limited to the number of people who could be in the room at the same time. And usually there are volunteers that are there to, tend to those kind of needs, just being a companion or, providing refreshments and that kind of thing. So the access of volunteers might be limited, or some of them might even be in high risk categories themselves. So they're self-isolating as much as possible. So definitely a decrease in direct human contact and supportive physical spaces would be the most noticeable thing. And then also individual counseling and support groups, can't be face-to-face anymore. It's still available by phone or video chat, but, not live and not incidental. It would all have to be planned.
It's not the same, it's like we were talking about beforehand. It's just you're not having that same kind of face-to-face. There's none of that, physical contact that might be helpful as well. There's just none of that. And I think that it's obviously still helpful, but yeah, it's I agree. It's difficult.
Yeah. And just the fact that people have to try harder to make it happen, they have to ask for help instead of it being offered just because they're there. And some of the other services might, by other team members or the volunteers, that might not be as readily available to families. Or if you're caring for somebody at home, those services might just not be as readily accessible in these times.
Yeah, I think that's something too that I saw with patients not on the palliative care ward that were in that sort of end of life process. It was even harder to have people visiting, and it was usually like very limited in time and to one person, and there just wasn't those resources on the floor as much, like you're mentioning, the spiritual care providers and everything like that. So yeah, and that's when you see like the whole family, that's who you can see is struggling as a nurse. You can kind of see how they're processing things, and you get that like assessment in your mind, right? Hard to do that if you're not seeing people.
Absolutely.
So in palliative care, what do you think like some of the major struggles that families have kind of coping with having a loved one in the palliative care process? And if there's any resources that you would typically kind of identify in the Nanaimo area, if you know any that would kind of help them maybe?
Well, I think, like we were just saying, isolation must be the biggest struggle, both in the hospital or at home. Family and friends and neighbors that might normally gather around and visit regularly are staying away because of restrictions, so that people aren't having as many of those moments for reminiscing or saying goodbye. And I think family caregivers, spouses and children that might normally have neighbors and friends and extended family to help with the caregiving or provide respite or just visit and provide emotional support, they don't have access to them, because you're having to limit the number of people in your bubble. I imagine caregivers have a lot less formal and informal support. So it makes what is a difficult time under the best of circumstances a much lonelier experience, and with much less physical affection and support, which, must be even more isolating. And then again, for bereaved families, not being able to have a large funeral or celebration of life or other rites of passage and community gatherings, that must have huge implications for their grieving process. As far as what would help, I think technology is probably the best tool for connecting us during this time. Video chat, Zoom meetings, email, and all of those can be done on one device, so it meets the criteria of limiting the number of personal effects and limiting the size of your bubble. And those devices could be loaded with photographs and videos. But all of that takes a lot more energy than just being in the same room with someone, and requires a person to have some level of skill. So you'd have to tailor the technology to be appropriate for the person. I'm sure the staff have taken on the role of providing IT support when the family can't be around, and ensuring the person has that right balance between rest and energy expenditure so they can enjoy the time they spend connecting via the technology. I've had a few milestone birthdays now, as have a lot of people I know and people in my family. And one of the things that people tend to do a lot these days is they'll create, they'll gather photos from across the lifespan and or have, record videos of people telling stories, sending messages and wishes. And I think that would be a great idea for a dying person as well. That way they can they have it to watch when they do have the energy and the tech support they need to enjoy it, and they can rewatch things if they want to. So trying to connect to people using technology, I think, is the best we can do for closing that gap. And as far as providing services as well, a lot of counseling services, or consulting a social worker, or a dietitian, somebody like that can all be done via technology.
Yeah, I think that's true. I like the idea that you mentioned there of having like people record stories and things like that. That's a really cool idea. It also kind of allows things to be a little bit more asynchronous, and they can be reviewed whenever the person has time and energy to do so. I think that's a great idea. Yeah, absolutely.
I'm sure people have come up with some really innovative,
yeah,
really innovative things. I just haven't heard a lot of stories yet. So.
Yeah. I think that'll kind of come up. We're learning so much through this. I feel like it's not something that I think most people in their lives at the moment have dealt with. Like, yeah, we had H1N1 before, and there was SARS and stuff, but nothing to this extent. So I think as a society, we're really learning, hopefully for the future going forward, as to how to deal with these things better from every aspect.
Yeah, and there may be things that we want to keep doing, even when when restrictions are lifted. If somebody's in another part of the world, and can't get home to visit a loved one, we've finessed these technologies so that people can connect remotely.
Yeah, and the caregivers, the nurses, everybody that's there to support is going to be more familiar with them to help, like you said, provide a little bit of pseudo tech support and help with that, which I think is really important. That's definitely something that I saw while I was in the hospital over the summer. And yeah, we're just, as nurses, spending more time from the bedside, which is nice as nurses, but with high workloads that can be difficult too. So do you have any recommendations for individual for people who are close to somebody like that has a family member who is in the death and dying process? So kind of people that are peripheral, they don't necessarily know the person that is in palliative care or is dying, but they know the person who might be struggling, coping. What are some things that they can do to help that person in this time?
I think it would be very much the same. Just connect in any way you can. Individuals with their loved ones, caregivers with their support network, professionals with the families and the caregivers. It'll look different because you can't be physically present, and technology can certainly fill the gap here, as we were talking about. Just reach out often, let them know you love them, that you have time for them, you're there to listen whenever they need, whatever they need. You're willing to provide as much support as you can within your limitations.
Yeah, I think that's wonderful. This is reaching out, because it's especially hard to do so right now. You can feel very isolated when you're at home with just you or a couple other people that are likely also going through the same thing. So, frequently reaching out, checking in. I think I agree with that. Yeah, finding ways to elicit some sort of response of how they're actually doing as well. Yeah, yeah, that's good. So do you have any other final kind of words of advice or wisdom for anybody who's having a family member or loved one in the death and dying process? Just kind of send off words.
Well, I'd really just like to remind people that, palliative care isn't just for people at the very end of their life. The origin of the word means to cloak, cover up. So it's all about alleviating symptoms and reducing suffering rather than having the emphasis be on curing. So there are many people among us who might have years or decades of life left, but they're living with chronic conditions that, while they're being managed medically, there is no ultimate cure. And so those conditions can be associated with pain and distressing symptoms and emotional and psychological burden, symptoms like breathlessness, nausea, fatigue, depression. And all of those people could benefit from palliative care for support and symptom management. And at this time, they might not have the access they normally do to their GP, their support groups, their exercise programs, their home help, their usual, complementary therapies and healers that they might normally visit. And they might be afraid to go to hospital when they do have an exacerbation of their symptoms because of the fear of being exposed to COVID. They might be self-isolating because they're at high risk for becoming seriously ill. If they were to contract the virus, they might not be able to get around if they normally would use public transport. It might be a good idea for them to consider an advance directive in case they do contract COVID, so that everyone in their orbit knows what their wishes are and can advocate for them. And for the frail elderly, if they're living in a care facility, they might not be able to have any visitors at all. So I think I'd just like to remind people to include all of those people in their net when they're thinking of providing support to palliative care. It's important to reach out to friends and family and neighbors, even if there's not a lot you can do as far as providing a solution to their situation, but you can alleviate their isolation and their loneliness and ease their suffering.
Yeah, I think that's wonderful. Thank you. Yeah. And thank you for pointing out too that palliative care is kind of a process. It's not just you kind of are in that stage at some point and that's it. It's kind of a gradient through a lot of disease processes. So yeah, I think that's something that gets missed a lot. So yeah.
I think we wait to provide palliative care for people until they are at the end of their life, when they could have been benefiting from some symptom management and all that social and emotional and spiritual support,
well before that,
decades earlier.
Yeah, I agree. And I'd love to see the shift to doing that more, hopefully, in my lifetime. Yeah.
It's definitely the vision of people that work in palliative care that we, connect people with palliative services a lot earlier in the trajectory of their condition, whatever it is.
Good, yeah. Absolutely. Well, thank you for meeting with us. I think you provided a lot of really valuable insight that will help people listening. So yeah, thank you so much.
Well, thanks for asking me.
You're listening to A Sound Constitution on CHLY 101.7 FM in Nanaimo. Today, we're discussing palliative care and end-of-life care in the Central Island and how they've been affected by the COVID-19 pandemic. Up next, we're going to play my interview with Carly. She is a fourth-year nursing student, along with us, who spent her summer working in palliative care during the first wave of the pandemic. So, without further ado, here's Carly.
Hi, everybody. Thanks for having me. I became passionate about palliative care during my summer preceptorship. And I really enjoyed my time there because it consolidated everything I've ever learned about nursing. I was able to provide my patients with the caring and compassionate patient care that they all deserved. It brought back my reason why I chose to be a nurse, and I'm really excited to further my understanding and to learn more.
Yeah, and while I haven't seen you in practice in the palliative area, I've worked with you before, and I'm sure that you're going to, when you graduate and you get into palliative care as a registered nurse as opposed to a student nurse, and even now as a student nurse, I'm sure you're just incredible, and you're going to do great things with your career. So it's a pleasure to have you.
Thank you, Ryan. And, I know you're going to do great things as well.
Thank you. So our first question for you about palliative care is, what is end-of-life care and what health professionals are involved in providing end-of-life care?
Okay, so The goal for end-of-life care is to really ensure that the patient is comfortable. We provide comfort measures such as pain management, control of nausea, vomiting. We provide emotion and person-centered care by collaborating with the patient about their desires in end-of-life care. So basically, we just want to make sure that the individual has a peaceful and comfortable death. As far as health professionals involved, I would really like to mention that there is a very collaborative, multidisciplinary team approach. There's healthcare aides, the nurses, physicians, housekeeping, spiritual care providers, social workers, occupational and physical therapists, unit clerk, the community and home support nurses. The list just goes on. From my experience, the healthcare team collaborates really well with the patient to ensure that a peaceful and comfortable passing will be had.
Incredible. And that's actually something that always kind of amazed me about healthcare. Like, I went into it with very little knowledge of what the healthcare system in BC was like, but it's incredible the amount of different professionals there are within healthcare in BC, at least. Like, and the way that they all collaborate together to achieve their kind of mutually identified goals for patient care, it's amazing. And I'm sure palliative care is no different.
Yeah, exactly. And I saw so many I worked with so many wonderful people that really just brought their different strengths and to their patients. And I don't know, I was very inspired by what I saw and the level of care and professionalism that was had on the palliative care unit.
Yeah, absolutely. I've heard really good things about NRGH's palliative care units. So, and kind of on that subject matter, so what services specifically are offered by inpatient palliative care units like the one at Nanaimo Regional General Hospital? Like, what are some of your goals, and why do patients come into the palliative care unit at NRGH?
Okay, well, so the reason why many patients come in are because they're experiencing a health challenge or a disease that the symptoms can be hard to manage at home. So sometimes people will come in just to get their symptoms under control. So for instance, if someone was having a severe pain crisis or they were having chronic nausea or vomiting, they would come in and we would manage their pain, their symptom. And once that it was all managed and they were able to further manage at home, then we would send them home. As long as they were safe and they had supports in place. Other times people came there at their very end of life stages, and we would ensure that they all had a comfortable and peaceful passing. The services that are offered there, unfortunately, I can only speak about my time there. I will try to shine light about the other services that were there. The only reason why I say that I can only speak about my time there is because I was there during the beginning of the COVID lockdown. So the whole hospital was on lockdown, and at the time, palliative care was the only unit in the hospital that was allowing 1 to 2 visitors. So before I arrived there, I was aware that the unit had amazing volunteers that would come in and sit with the patients and their families. They would ensure that no one was alone. The volunteers would do amazing things like make tea, coffee, and snacks for all the patients. There are lovely homemade knitted blankets and pillows for all the patients that were made by the volunteers as well. Unfortunately, with COVID, the volunteering had to be put on hold, but I assure you that the staff there has kept up with everything that the volunteers did. However, I do know that the volunteers were greatly missed. They made a very positive impact on patients and their families. A couple services I would like to talk about was the spiritual care providers. They had a very active presence on palliative care to ensure that spiritual, religious, or cultural care was implemented if the patient desired. And also social workers. They played a large role on palliative as they connected the patient and families with resources in the community for patients who were going to be discharged.
It's incredible just to hear about some of the team that you worked with there. Like they sound like incredible people.
Really, they are, and they all just genuinely care about people, and their main goal is just to ensure that everybody is comfortable and happy. And it's not just the patients that are our responsibility. The families are a big part of that as well, and we want to make sure that this is as pleasant as an experience as it could be for everybody involved.
Yeah. And you kind of already touched on it a bit there with how the services had been impacted by COVID-19, but are there any other end-of-life services that the pandemic has affected greatly in the inpatient unit?
Well, the one thing that was probably the most impactful on the patients is the limited visitors. So there would only be about 1 or 2 visitors at a time. Before COVID, I was aware that there were no visitor restrictions. It really is too bad that there cannot be more than 1 to 2 visitors at a time. But we did get creative with allowing patients to see their families, either that be the video calling or luckily palliative care was on the ground floor. So we were able to have patients visiting with their families through the windows. And as I mentioned before, the volunteering and any other out-of-house services beside cultural or religious practices had to be put on hold as well.
It's a shame that those kinds of restrictions have to happen during a time like this.
It is, and then, I just saw how the nurses and other staff that worked on the palliative care unit actually, supplemented with all of this. So there would be times where, there's downtime. So I'd go and sit with a patient, have tea, and just chat. They're not there just for end-of-life services, how I saw it. And, I learned a lot about people, and a lot of these individuals had amazing lives, and they just want to share that with me at their last moments, and just not allowing people to be alone and uncomfortable. And so that's why I really liked palliative care, because you were able to put the patient first and value your time with them.
Yeah, that actually, what you said there actually kind of reminds me of something that one of my very first nursing instructors told me when I was having one of my first experiences with death and dying. And she told me, paraphrasing, but it went something along the lines of nobody should die alone. And to me, it sounds like that's a big part of what the staff, and especially like the nurses and stuff in palliative care, do, is just be present and be there with people at the very end of their time on earth. So that's
exactly
pretty incredible.
I agree.
So what are some common questions or misconceptions about in-hospital palliative care that you know of that you might be able to answer a bit about?
I think a common misconception about palliative care is that it is just about end-of-life care. Palliative means to relieve the symptoms that are unpleasant, like I spoke about earlier. So many individuals do have a chronic illness or disease that have symptoms that have contributed negatively to their quality of life. Some people would come in for a pain crisis or have chronic nausea, vomiting. So we get them on scheduled medications. And once their symptoms were under control, we were able to discharge them home. So palliative care does not mean that people are imminently dying. Another misconception I came across is when I would tell people that I'm passionate about palliative care, many people think that it's all doom and gloom. I agree that it's a hard emotional job, but it's also so honoring and humbling to be able to assist patients and their families in this transitional point. I truly want nothing more than to provide each of my patients with the compassionate care that they deserve. another misconception might be that palliative care only happens on the palliative care unit. This is not true, as palliative care is all over the hospital. As I mentioned that, a lot of pain management or chronic nausea, vomiting, but people do experience end of life on other units. And I can assure you that everybody is doing what they can to ensure that your loved one is comfortable.
Yeah, I've personally seen palliative care happen it can happen anywhere in the hospital environment. It really doesn't matter what area you're in. So,
mm-hmm.
And every time that I've seen it, I've always seen it managed quite incredibly. Like it, from my experiences thus far as a fourth year student nurse, Vancouver Island, or at least the Nanaimo area, has just incredible staff that are just so caring and incredibly passionate for providing patients who are going to die with a good death.
Yeah, I agree.
So, one final question. Do you have any final words of advice for those who have a loved one in palliative care, or those who might be supporting friends who have a loved one in palliative care during this time?
Yes, I'd like to stress that you are not alone, and, dealing with a loved one that is going through end of life care, it can be hard. But there are so many people that can help you and assist you through this transition point. So just reaching out to your friends and other loved ones, and just really taking care of yourself as well. I know that right now during COVID, it's even more difficult to travel or get the whole family together to visit your loved one if they were in the hospital. But I can assure you that the staff on palliative care is an amazing group of individuals. I saw how caring and compassionate they all were. Your loved ones are in such great hands with people who care so much about them. I think it's just important for you to take care of yourself as well, because self-care is really important, and your mental health and mental well-being matters as well.
Absolutely. You're listening to A Sound Constitution on CHLY 101.7 FM in Nanaimo. Today, we're discussing palliative care and end-of-life care in the Central Island and how they've been affected by the COVID-19 pandemic. We'd actually really appreciate it if, after listening to this, if there was a big takeaway for you from the episode, or if you have any questions or comments, concerns, anything like that, please let us know on our social media.
So today in this episode, some of the things that we talked about were how being in a global health crisis has affected how palliative care is delivered or engaged within, and changes within both the settings at home and within the hospital of kind of the restrictions that we kind of have to work within due to COVID-19 or really any other health crisis or health emergency. We have to kind of work through and be socially distanced, be mindful of everybody, assess our own risk, and just be there for each other. Reach out to our friends and family any way that we can safely. Be a source of strength for each other as we're kind of still in the midst of this very, very difficult time. Especially, like I said, when it comes to those already particularly isolating processes of grief and death and dying.
Absolutely. And we also kind of gathered a fair few resources during the research of this episode, and we've made reference to them here and there throughout the episode as well. But we also do have those resources kind of gathered up and available for you if you'd like to learn more on our social media as well. So make sure to check that out if you do have further questions, or as always, you can also ask us directly on our social media, and we'd be happy to answer any questions you have as well.
Absolutely. Yeah, no, thank you for listening today. I think this is it's a difficult topic for people to think about. It's not something that we that our brains like to consider as an eventuality, but I think it's an important thing to be aware of, whether we're going through the death and dying with our family or a family member or a friend personally, or if other people in our lives are kind of going through that with people that are close to them. So thinking about it now, it's uncomfortable, but it's important, especially during an already difficult time. So thank you for joining us for this episode. I think I hope you took something really valuable away from it.
Yes, thank you so much for tuning in. We really appreciate it, and we hope you learned something and can take something away. We hope you enjoyed today's episode. We encourage you to reach out to your healthcare provider for more information. As always, check out our Facebook page for additional resources related to today's show. Every episode is uploaded to our YouTube channel if you'd like to hear it again. If there are any topics you'd like us to explore, please contact us at asoundconstitution@gmail.com. Thank you for listening to A Sound Constitution on CHLY 101.7 FM.